today is myself, County Executive P.J. Wendell, Christine Schuyler, and Sheriff James Patron. Just to quickly recap the week, on Saturday the 18th, there were no new cases of COVID-19 to report, leaving our total at 27. On Sunday and Monday, there were no cases to report either days, and on Monday, the number of active cases was down to 2. On Tuesday, there were no new active cases, and Wednesday, we announced there was 1 case, bringing our total to 28, but yet we had 1 case leaving as active and one new one added. Yesterday, we announced 1 additional case, bringing the total confirmed cases to 29, but we also had another recovery, so our recovered cases remained at 2. Today, there are no new cases of COVID-19 to report in Chautauqua County, leaving our total at 29, and there are currently 2 active cases. 24 have fully recovered, and unfortunately 3 fatalities. Today, we have 72 cases under quarantine or isolation orders and are continuing to be monitoring. And another important figure is 698 tests have returned to Chautauqua County as negative. Moving quickly, some of the things that happened the rest of the week. On Wednesday, I announced that the county was going to ask businesses to create a reopening plan that will protect the health and safety of their employees as well as the public. This process was vetted by my COVID-19 response team, agreed upon as the next logical step while the state looks to reopen on a regional approach. While the governor is the one who can decide when the reopening will begin the economy, I believe it is good business. I think it is good to get the business thinking about the process we would like, so our county is primed to move quickly once we get the green light. Again, this will not be as simple as turning on a switch and the economy will return, but yet gradually moving our economy back to a working order. As we've seen with our businesses, our community is stepping up to answer the call for the COVID-19 fight. All of our local businesses will be equally thoughtful and enthusiastic when creating their reopening plans. As I've asked them to step up or answer the governor's call as well, I am sure this call to prepare for opening will be just as enthusiastic. They'll be thinking outside of the box and thinking on ways to change their business, customer service, and the interactions they have with the customers to ensure their safety. So without further ado, I will turn the mic over to our Public Health Director, Christine Schuyler.
Thank you, County Executive Wendell. Good afternoon, everyone. As the County Executive has gone over our numbers, you can see that the prevalence that we know for testing and positive cases in Chautauqua County remains low. Having said that, I would like everyone to know that the testing criteria for patients within Chautauqua County has been broadened. Anyone who is experiencing symptoms of COVID-19, such as a fever of 100.4 or higher, cough, shortness of breath, chills, muscle pain, or sore throat, or a new loss of taste or smell, or any other flu-like illness, is heavily encouraged to notify their healthcare provider to see if COVID-19 testing is appropriate. We do have more ample testing supplies in the county now, so we would like to have more people tested who are symptomatic for COVID-19. In addition to that, I was just informed that the WellNow Center in Dunkirk will be performing COVID-19 testing and as well as antibody testing. I don't honestly have a lot of information on that. I just received word of that, so I'm sure more will come from there. Our other testing sites within Chautauqua County are UPMC Chautauqua in Jamestown, the Chautauqua Center, our federally qualified health center with locations in both Jamestown and Dunkirk. If you feel that you need to be tested for COVID-19 and you are symptomatic, we ask that you call your healthcare provider who can refer you for testing at one of those locations. Or I believe with the Well Now option in Dunkirk, you'll be able to call them directly and be evaluated there as well and have testing done. As County Executive Wendell said, as far as businesses reopening, I know there's been a lot of concern about that on both sides. I would like to reassure the residents of Chautauqua County that as the governor works statewide and we work regionally to reopen our businesses and our community of Chautauqua County, We will continue to do our public health work. We will continue to do contact tracing, case investigation, surveillance. And I promise you, at any time, if we do see an increase in cases and we see a spike or we see what we call a hotspot, anything that warrants us to try to curtail again the interaction and put community mitigation efforts in place, that will happen. But this is going to be a very slow, methodical process. I'm certain that that's what Governor Cuomo will come out with when we do start to reopen our community. It's not going to be a light switch. This is very much more so like a game of musical chairs, you know, where we quickly shut things down when we had to. And now we're all going to go around and around and around till we find the proper place to sit. And be very careful about our social distancing going forward. Life is not going to return right back to normal as we've known it. We have to be very careful. We have to be very cognizant that our past history with pandemics shows a second wave that could come our way. So with increased testing within our county, I think that it's going to give us a better idea of where we're at and how we can move forward. There's not been testing as much as any of us would like to see, and we still don't have the supplies to do widespread testing, especially of asymptomatic patients. But that is getting better all the time, and I do believe that within the coming weeks we'll be able to increase capacity even further.
Thank you. I'd just like to add, there are some numbers here. People have been inquisitive as to our hospital. Right now, dating back to the 8th of April was the last time we had a person as an inpatient as a COVID-19 positive case. Since then, we have not had anybody admitted as inpatient or an observation. Going back to the April 8th, again, we have not had anybody in ICU. And dating back to the 6th of April was the last time we had somebody intubated in ICU with COVID-19. So the numbers as far as our hospital, some people have asked, what is our hospital capacity like? We do not currently, and we have not since the 8th of April, had anybody in our hospitals throughout Chautauqua County as a positive for COVID-19. So that stress on the hospitals, as some people have questioned, we have not seen. So I just want to get those numbers out there. Unfortunately, as we know, life goes on in Chautauqua County. And one of those instances we're going to talk about, I'm now going to defer to our Chautauqua County Sheriff, Sheriff Quattrone.
Thank you, Mr. Wendell. First, I'd like to thank everyone for the measures, the preventive measures that they've been taking to prevent the spread of the coronavirus, such as wearing our masks, facial coverings, social distancing. But we continue to receive many complaints or various complaints of people who are not doing so. As law enforcement in this county, each of the chiefs, the captain from the state police and myself, we will continue to educate and warn individuals and businesses in hoping that they will voluntarily comply with these requests. But we are happy with what we've been seeing with agencies, organizations in the faith-based communities in different areas, and the measures that they've been taken to try to keep life as normal as they can during this situation. Unfortunately, what we've been seeing is a continued increase in the number of drug overdoses in our community. We've had 45 overdoses and 2 fatal overdoses in the month of March. And so far in April, we have seen 14 overdoses and 4 fatalities. So we encourage those who are struggling with addiction issues to reach out for help. Services are still available, and we want those people to reach out, but we also want those who know somebody who's struggling with an addiction issue to reach out to their friends and family and encourage them to get the help that they may need. And as was in an earlier press release this week, we talked about the Good Samaritan law, and that is still in effect. If you know somebody who is struggling or somebody who has overdosed, please don't hesitate to call 911 to get them the help that they need. And you will be protected from the legal authorities. So our goal is to help people and to see people survive this pandemic and the epidemic of the drug abuse.
Thank you. At this time, we'll open the floor for questions. Those on the telephone, we'll start from the bottom and work our way up. We'll start with Terry Frank from WJTN.
Thanks, BJ. I did have with regards to testing. Mentioned the ramp up, and I know the governor earlier this week announced that there had been 3,000 in this preliminary antibody testing, where about 14% were being reported as having been infected at some point and had recovered. Any word on what Chautauqua County may be getting out of this? Were we one of the counties that was involved in this?
I can ask it real quick. We were not one of the counties that were involved. Dating back to April 12th in a call with the governor's office, I asked if we could be included in this. I believe the antibody testing is significant. We were not included. Again, asked on the 20th of April, and we were not included as well. But again, unfortunately, we were not part of that test, which was 3,000 people throughout New York State, a populace of over 19 million.
Within that data, Erie County was the closest county to us that was included in that study of 3,000, that sample. And that really was just a serological survey. Per the State Health Department epidemiological experts, they really don't know yet what it is that they're going to be able to glean from that. It really does not mean that you're immune. It doesn't mean that you've had the infection. So there's still a lot of science that has to be done to really be able to figure out what those results really mean. Within that, 13% was the average across the state, and the percentages were different within New York State itself. And I apologize, I didn't bring that with me, but I can tell you off the top of my head that the rate for the rest of the state, which means outside of New York City and the major counties were right outside New York City where the hot spot has been, was 3.7%. So that's much lower than what the state average had been on those numbers. No, the State Health Department could not tell me of any time when there would be widespread antibody testing. So I was very surprised to hear from Well Now as far as having that availability, because I have not been aware of that from the State Health Department.
Thanks.
You're welcome. Moving up, WDOE, Dave Rowley.
Well, good afternoon. Wanted to, and maybe this question should be directed to the sheriff, but New York State Governor Cuomo's office put out a press release this afternoon indicating that there was an uptick in domestic violence cases across the state that are connected with social distancing and the COVID-19 pandemic. Are you seeing an uptick in numbers here in Chautauqua County?
Yes, we are. Up to this point, we have seen about an 80% increase in domestic disputes, calls that we've responded to. In addition to that, we've seen nearly 100% increase in mental health type calls. So, when we talk about social distancing, I've mentioned before that I would prefer us to maybe even talk about spatial distancing, that we have to continue to reach out to those that we care about and love. We can do it through different media, picking up the telephone, but we can also, we now have those different venues such as Skype and Zoom that we can utilize.
Now, should people be utilizing some of the resources that are available, such as some of the domestic violence hotlines?
Absolutely. And, reach out there. Chautauqua County, thankfully, is rich in resources, and we encourage people to utilize them as much as they can, or as much as they need to.
Okay, thank you.
And kind of along that note, this is also Child Abuse Prevention and Awareness Month, and our SCR reports are reports of suspected abuse and maltreatment are actually down. But we don't really feel that's probably a good thing. We know that a lot of our mandated reporters, teachers, school, social workers, for example, are not having daily contact with our kids. So it's very important for the entire community to be aware of what's going on around them, check in on your neighbors, be aware of what's going on in your neighborhoods, and if you suspect that a child could be in danger, please do not hesitate to call 911 if it's an immediate danger, or make a report to the State Central Registry.
Thank you, Dave. Anything else?
Nope, all set. Thank you.
Thank you. All right. Mr. DiAgostino, any questions?
So the hot button item around Chautauqua County seems to be the reopening. You sent out a release on Wednesday discussing this, and you asked for businesses to offer some suggestions. Have you received any response yet from any businesses in this regard?
Yes, I've received two almost within 24 hours, and they were businesses who had some questions coming into this, and it surprised me that they were brought back so fast. But yes, I know before this happened, as the governor was looking at the 50% reduction, I had some people that, personal friends of mine that worked in different industry were asking, could we do this? Could we, how to limit staff? And I feel confident that a lot of those plans were well thought of, but at the time they were not things that could be implemented. For example, if you had one shift, you could split the shift in half and now run two shifts, and your first shift would run its normal hours. You'd have an hour gap in between, bringing second shift in, instead of from 3 to 11, it would maybe go from 4 to midnight. So there were ideas and creativity and thinking outside of the box happening already as the governor rolled out the 50% mandate that first happened. So I feel confident that businesses will reach out to us. I don't know if they've gotten any to the county health department, but I know Senator Borrello and Assemblyman Goodell also are asking for those as well. So, we urge businesses to, work on those plans and please get them to us. That way, we can look at them, and then, if somebody were to ask us how many we have, we could give them a number. That way we know how many businesses are ready to get started.
So speaking of the reopening, one of the concerns is unemployment's high, but there are jobs out there. So is there a concern in this county that some people who are currently unemployed may not be looking for work because of their concern about the virus still being around?
That I can't necessarily speak to. I'm not, this would be, certain individuals may have concerns. Obviously, their health concerns could be one of them. But as you said, there are jobs throughout Chautauqua County going into this. I know when we first started, there were several different businesses, including Refresco, who had reached out to us and said as an essential business that they were looking for positions. So I know our unemployment rates are high, but I know there are businesses that are looking. And I would believe that once these plans start to come out, individuals would realize and investigate that the businesses are doing their due diligence and preparing or making sure that their employees are safe and customers are safe, that we should be able to put some of those concerns aside. But again, each individual is up to their own decision as they look for employment.
Two other quick questions. The more we learn about this virus, the more we find out. It may have been here long before March. Is there any thoughts from Ms. Schuyler, your sense on if the virus could have been here in January or February, because people had symptoms reporting the flu, and if it wasn't the flu, they were told that they needed to move around and make sure they keep air in their lungs because it might be pneumonia. So could that have been COVID-19 well before we knew it was here?
I honestly and personally think it's very possible that it has been here, and it's been here longer than anyone has really probably thought it had been. Maybe in the future we'll know more from the antibody testing once it gets perfected and comes to our area more robustly. We did see an uptick in pneumonia-related deaths at the end of March. Pneumonia is a complication that is the deadly complication usually and causes very severe illness with the COVID-19 infection. We did have a lot of influenza-like illness that tested negative for influenza throughout the course of this flu season. So it's a really good question that I don't think any of us have an answer to right now.
And one last question for Sheriff Patrone. There's concern from residents when they walk into store, they don't see other people wearing masks, or they don't see other people wearing masks walking around town. Is law enforcement getting tough on people, or are they just issuing a warning or reminder? I mean, how is that being handled?
John, currently the way the executive order was put out is there's no actual enforcement of this. It's a warning. It is a encouragement. However, stores, if they choose to post signs and prohibit someone from entering, that is well within their right to do that. There's exceptions. If you can practice the social distancing of being 6 feet. So if I'm walking down the road and I don't have my mask on, but I'm well within that social distance of 6 feet or beyond that distance of 6 feet, that's going to be fine. So right now we're still encouraging it. We are encouraging businesses to limit the people who are coming in, and also to make sure that they are wearing masks. But at the same time, we're asking customers to respect those that are around them and respect the employees of these stores. Many times we've had employees asking customers to either not come in or to put a mask on, and the customers are retaliating against the employees, and they are trying to really keep their community safe.
Well, that's great. Thanks for the information. I'm all set. Thank you.
Thank you. Mr. O'Connor from Chautauqua.
Yeah, I have several questions. Number one, if you look at the big box stores, Walmart, Home Depot, Wegmans, they are open. You look at Chautauqua Mall, that is closed. What's the difference?
I guess the difference would be up to well, first of all, Wegmans is a food grocery store. That's considered essential.
Is Evans Liquor Store essential? They're open.
And that was the governor's order. So for the governor and the governor's office is who determined what was considered an essential business and what was considered non-essential. One thing about malls, the governor's order also did speak to malls having to close the inside of the mall so that only stores that had an outside entrance could be open, and it had to be one of those, again, those essential businesses, which unfortunately, if we want to look at locally, like our JCPenney's or our clothing stores, not considered essential at this time. So.
Well, my point is that with government officials telling people you're essential, you're not essential, do you think that really confers any benefit? I mean, I don't see that there's a quarantine when I walk into Wegmans. People are walking around, some have masks, some don't. People at Cummins Engine are working. I see people gathering close together all the time, and yet other small businesses that don't have the cash reserves are oftentimes family owned. They're closed, and some of them, let's be frank, are not going to reopen.
And I think, at least as far as locally, I can say we appreciate your concerns and your sentiments and share them. But once again, the governor has made the declarations and the executive orders as to who's essential and who's not, and what can be open and what can't be at this time. And that's really what guidance we've had to follow and that we're going on. There should not be large groups of people gathering inside a grocery store or a hardware store that's open for essential business only. That's part of, no unnecessary travel and limiting your exposure and limiting your trips to the store. I think is everything else in this world seems to be, only takes a few bad apples to spoil the whole bunch. And I think if we can get the greatest cooperation out of the greatest number of people, we're going to get through this, much sooner and much better.
We had 881 confirmed flu cases this flu season. We have 29 confirmed COVID cases. There hasn't been a hospitalization in a couple of weeks. Has the county thought of pushing back to the governor and saying, look, we simply do not see the benefit, and we certainly see the downside in our business, our tax base eroding, et cetera, to this quarantine when we simply are not seeing the virus spread in any significant way here?
The pushback that I think is happening, that I think everyone is pretty well aware of, coming from County Executive Wendell and Assemblyman Goodell and Senator Barillo on our state elected governor and that office to really look at things from a regional perspective, and even closer than that as a county perspective, because we are much different, let's say, than Erie County, New York, and the metro areas where we really see the hot spots. But having said that, just because we don't have a lot of confirmed cases doesn't necessarily mean that it's just safe for us to open things up and go for a free-for-all, because that is absolutely not the case. I'm not confident of that. I don't know exactly what this virus is going to do. I think we've done a good job of social distancing and keeping things at bay and not being close together. Once we start doing that again, I don't know what this virus is going to do. We're going to find out, and we'll deal with it when and if that happens. But there still has to be some caution that goes along with any sort of a pushback, and it's our responsibility, each and every one of us that live and work in this county, it's our responsibility to make sure that if we say to Governor Cuomo that we're prepared for this and we can do this and we're going to do everything that we need to do to keep everybody safe while reopening our economy, and you need to look at us differently, then we better put our money there.
So you're saying that this could get worse in Chautauqua County in the future, and we simply don't know when the danger, so to speak, is ended?
We don't know. No one really knows what this is going to do. It's novel. It's a novel virus.
The reopening date will be kind of picked out of the air as, we think we're safe now, but we don't know.
I mean, there is some study going into this, especially when you look at the outbreaks that were in New York City and the amount of disease. I mean, we're trying to make sure that there is a decrease in disease and that our prevalence that's been low remains low. We do more testing now that we have more supplies. I don't think there's going to be a hard and fast date that says everything's going to open up on this day. I think it's going to be a very slow and gradual process that starts with our low risk areas. I'm very curious to see what's going to happen in some other states that are starting to open up, and especially ones that are starting in higher risk areas such as massage and spas and those sorts of things. So we're going to watch and we're going to learn, and I think we're going to move as quickly and slowly as we can.
And final question, what economic price finally, Mr. Wendell, are you willing to pay? 10% unemployment, 20% of the tax base gone?
What price am I willing to pay? Personally, I don't necessarily think it's what I'm considered willing to pay. Any price is too much to pay in Chautauqua County. I hear people calling me from several big businesses that are losing customers, and I'm deeply concerned about that. And on a 2 o'clock, or Amanda could share between 2 and 3 o'clock, I think today's 3:30, phone call with the governor's office, I share my sentiment is how we need to be examined as a different entity as far as opening at a different rate. Our numbers here are low. There is no acceptable loss in Chautauqua County. There's no acceptable rate of unemployment. We need to make sure that, one, the residents of Chautauqua County are safe. For every person in the last couple of weeks that has sent an email saying we need to open, we get just as many emails saying that we need to stay closed and be judicious. So the numbers that we look at, this plan is evaluated daily by our COVID team. The data that's out there, the statistics that we get, the testing data that comes back, we analyze every day. We are also in concert with our Senator Barillo and Assemblyman and their regional plan. Kathy Hochul is now the Western New York representative, and she will be looking at our information and data. But again, the ultimate call to open back up is the governor of the state of New York. If it were mine, I'd want to get open so we can get our businesses back in order, because I know this is affecting everyone. It's affecting our economy. It's affecting the small businesses. But at that time, and right now, this is the decision of the governor of the state of New York.
To ask that anyone who's coming back into our county, whether they have a second home here or they somehow have gotten away on a trip where they've had to have gone someplace else, such as New York City, they please self-isolate for 14 days on their way when they come back into the county. It's not just the second home people, but we still have people who have to travel for necessary reasons and travel into a hotspot, and that's how disease spreads.
Western New York News Now.
My question is for Public Health Director Schuyler. We had some viewers this week reach out to us about the concern for false negatives in regards to COVID-19 testing. Is that a concern for the health department here, and have we seen any?
Well, I don't know if we've seen any, because we would know they were false. But there is a false negative rate that goes along with this test, and it's close to 30%. So there is that chance that someone can be testing negative, but that is the same with every test that's out there. So that's not something that's special or unique to the COVID-19 test. That's one of the reasons why we continue to isolate people and watch their symptoms, regardless even if they have a negative test. We still are giving them advice on how to isolate and when they really should be going back to work or going back out into the community. The FDA did just approve a diagnostic at-home COVID-19 test, which some people may be hearing about. The test is very limited in use and in availability, and I was told by the State Health Department yesterday that it is not available in New York State at this time. It's made by a company called LabCorp, and it requires a doctor's order to obtain, and they really want to do, I think they're going to watch that with some more studies because of a much higher false negative rate that could accompany that take-it-home test.
And I would imagine if someone was still sick even after seeing a test come back negative, they likely maybe don't have COVID, but they have something else that still could be contagious, whether it be the flu. And do you think going forward, following this public health crisis that we've had in the pandemic, that people might be a little more watchful and a little more receptive to, I'm sick today, I'm not going into the office?
I sure hope so. I mean, I really think I think one of the silver linings that's going to come out of having a global pandemic. People are much more aware of, touching objects and touching their face and having real close contact with strangers or, massive, crowds of people. And I think we're all going to wash our hands more frequently and use hand sanitizer and be a little more cognizant of our own well-being and that of our families as we move forward. I think there's been the testing for influenza has gone down, I think, because everyone's been just worried about the COVID testing. And if you don't go in and get examined by your provider, let's say, and you have a telehealth visit, and really the question is about COVID, this time of year, we're definitely on the downswing of the influenza season. And sometimes we aren't testing then for influenza to even see if that's what the pathogen is. If we know it's not COVID, we're just going by that. We typically have an influenza season. We had a brutal influenza season this year. A lot of people were very, very ill from this. But unlike influenza, right now the preliminary research on the coronavirus is that it doesn't wax and wane like the flu does. It's not impacted by climate change I don't mean climate change, I mean change in temperature as far as someplace with a warmer climate versus someplace with a colder climate. And typically with influenza, another reason we see it so bad up north here is because people are inside, they're close together, they're sharing space. All this social distancing and these practices with respiratory hygiene that we're learning, I really think is going to help decrease the incidence of a lot of respiratory illnesses moving forward, as long as we never ever forget the lessons that we're going to learn after this pandemic.
Nationally, public health officials have warned states who are opening up now, when you open up, you might see more cases. Is that something that we could see here as we begin to lift the veil?
Oh, I would not be surprised at all if anywhere we see more cases, just because people are going to start coming together more. There's going to be more close contact. There's just raises the risk. If you're looking at an infection that's spread by droplets, you've got to be close to one another to get that, and the risk of that goes up. So everyone pretty much is expecting to see higher numbers moving forward. But that's why public health is here, to have that test done, to identify those cases and to isolate them, do the contact tracing, and keep that from spreading into an actual outbreak.
And then I did have a question for Sheriff Quattrone in regards to enforcement of the governor's executive order, which still at this point is in effect. For people who are out in the community who are concerned with groups, I know there was a hotline and a website that was set up by the state to report things. Just this week in our newsroom, we've gotten calls from people who are upset because people were still gathering. What does your sheriff's deputies do if they get a bunch of calls saying there's a big group of people somewhere in the county? Do they go and try to talk to them and explain to them that it's best not to be so close together?
That's exactly what we're doing, and this is something that, again, the police agencies across the county are doing. The hotline and the website for the New York Pause, the county executive and I both get copies of every complaint. So if it's in Jamestown, I will forward it to Chief Snellings, Dunkirk to Chief Ortolano. Whatever jurisdiction it is where we forward the complaints to. As we get complaints of larger gatherings, we do send a car to talk to the individuals and try to get them to disperse. If they're on private property, we continue to, again, the warnings and the education. Ultimately, they could be charged with under a public health law. Our concern, maybe our plea, as I mentioned earlier, that we have, we've seen an increase in overdoses, an increase in domestics, increase in mental health calls. And unfortunately, when people are choosing to not follow some of these orders, it's creating more calls for us where we could be perhaps utilized to keep the community safer instead of having to respond to, wearing this mask isn't always comfortable. It's not fun. It causes us to feel a lot of discomfort. But if we're doing this voluntarily so we can protect those who are around us and show the respect to those who are around us, that could go a long ways in helping us to reopen some of the things that are going on around us.
Do you know how many reports that Chautauqua County has received in regards to people who have complained about large gatherings?
I don't know the number. I have all of those. Unfortunately, sometimes there are many complaints for the same place, and they're unfounded. And so we continue to look into them. We continue to reach out to the groups. We have a lot of times that the work that the company is doing or the business is doing is considered essential, and they are practicing proper social distancing. Sometimes those complaints are coming in because somebody's upset that somebody's considered essential and somebody else isn't.
I wanted to ask you, next Friday, there's a scheduled protest in Jamestown, and I want to ask County Executive Wendell, too, about this to get his thoughts and reaction to it. The protest leaders, part of a statewide group, are recommending that people take proper social distancing as they protest the governor's pause order. Do you know if the sheriff's office has communicated with Jamestown Police or other agencies to talk about monitoring that situation?
Jamestown Police are aware, as I believe every police agency in the county is aware of the protest that's going to be happening next Friday, well within individuals' rights. And we just, again, I'm glad to hear that the organizers are encouraging the social distancing, and just to have this as a peaceful protest, that's perfectly fine that they're out there and letting, hopefully this message gets back to the governor and that he can hear the displeasure of the western part of the state in some of his policies.
Executive Wendell, to that point, I imagine you've probably heard about the protest. What's your reaction to it?
It's the same as, the sheriff had just said. We're not stopping their rights to protest. It's one of your constitutional rights. And as I saw in your broadcast, that's what it's a constitutional-based group. So they're well within their rights. But social distancing is what we're asking, and that's what needs to be maintained. I like to think of it as being neighborly, being a good neighbor. That's really what we're asking everybody to do. And, again, their right to protest is guaranteed them by the Constitution. And, again, to echo what the sheriff said, that the governor would be able to hear this. And obviously not hearing it from me every other day on a phone call via his representatives, that there are other people that are concerned and would like to see us reopen sooner. But again, that's, they're within their rights. We just asked, again, to make sure that it's a peaceful protest and make sure that they're following social distancing and, protecting themselves and others.
Christine, did you have anything to add in regards to that or no? Another question for you, County Executive Wendell. Obviously, the governor is in charge of the reopening date. They are following the plan that Senator Borrello and Assemblyman Goodell put forward. For you as County Executive here in Chautauqua County, what is your preferred strategy to move forward with this? Is it something where all of a sudden we say, okay, we're going to open back up, or is it going to be something that's slow? What did that look like to you?
Well, I think it's going to be slow. I was in concert and been in contact with the senator and the assemblyman as they put their plan together. Talked to them several times, and I think it's a very good plan in the fact that we are bringing businesses back. The places that have a low prevalence of passing this disease back and forth are the ones who are going to open first. And it's very, again, it's going to be a very judicious way to, one, mitigate the spread and also maintain the safety and health of all of our residents. Like you said, we're not going to turn a switch and everything's back open. There will be gradual steps, different phases. And as we feel they're successful, then we'll move on to a next phase. Just the same as everybody that's been looking at this, whether it's a nationwide perception or plan, or again here in the county. But again, it's going to be done in a manner that is, one, safe, and two, very concerted, that we are not, causing clusters or outbreaks. But, having said that, we talked about this last week. As these begin to open, there potentially is the uptick in cases. But I feel very confident in Ms. Schuyler and her public health group to really get after this. They've got a crack team right there that as soon as these positives come in, they get right on the contact tracing, they get right into the isolation orders, and they really take control of the situation. I feel very confident as if we were to see an increase, that they will be able to mitigate that and take care of it responsibly.
I know the governor during his daily updates always seems to talk about faucet kind of idea, where you can turn the water on and slowly turn it back down if it does become something that can't be handled. To either Executive Wendell or Director Schuyler, in regards to the containment, would we say we open up? What's the process to either bring things back down a level or just contain areas that maybe would develop some sort of problem going forward?
That would depend. I mean, that would be on a case-by-case basis to see what the situation was, and that would be determined by our case investigations and contact tracing, and to see what level we had to go to.
Contact tracing, is that where you go through and you sort of create a history of where someone's been, and then you try to grab those cases before, or potential cases, before they spread further? How does that work?
Kind of, sort of, in a simplified way. Yeah, there's a case investigation where our nurses really dig into the actual interview and talking to someone who has a positive result, and getting a list of all places they have been and people they have been in close contact with, and sorting through all that, and then making initial contact. And then when you have anyone, if we put any of those people into isolation, then there's a process of continually following up with them, seeing if they have any symptoms and how they're doing, and monitoring people's movement, so we can try to do all that we can to contain the spread of any illness.
I'd imagine the idea with the masks then is if that person, say, did go to Walmart in Lakewood, they wearing a mask in the store wouldn't have spread it as normally if they didn't have a mask on.
Correct, because you close contact, is really defined if you're within 6 feet of someone for a solid 10 to 15 minutes, and that's without any protection of any kind. Passing someone in the hallway would not be considered a close contact.
Keep in mind with that is, the public health department this is nothing new to them. If we have an outbreak in a restaurant, it's the same type of activity. They, get to the source and they find out where that is, and then they start to handle that accordingly. So, although the novel COVID virus is unique as far as the expanse of the number of cases that could happen, this is something that the public health department has done before, and I feel very confident in their abilities.
Public health, whether it's tuberculosis, whether it's STDs, pertussis or whooping cough, there's over 70 reportable diseases, that we keep track of, and if we have any incidences, then this is what we do.
Thank you. That's it for me.
Anything else from anybody else? If not,
I know we've had some questions about our numbers, and that there is some data out there from Johns Hopkins University, and they show us as having a higher amount of positive cases than what we show. And I think it's important for everyone to know that the most reliable source for data is your county health department in New York. I'm not going to speak for other states there, but as far as the way the New York system works, really the county level is your most reliable source, your most credible source. Believe it or not, I know for some of you, but it's very true. Someplace like the Johns Hopkins data, from what we can discern, they're not taking the data after it's been cleaned. They're kind of getting an initial dump of data. What we do is we go through all of that data, and you have to sort out who actually is a resident of this county, who's a resident of another county or even another state. Some in Chautauqua County. So only the test results that are positive count for Chautauqua County if you are a resident of this county. I hope that makes sense and helps to clear that up.
So the Johns Hopkins data then, because I did see people commenting about that, is that just if they were tested here or if they once lived here? How do you know how they get their data?
Email to the Johns Hopkins folks and haven't gotten an answer yet as exactly where they're getting all of their data from. But for instance, the New York State data has us as one more positive than we have, and we've been telling them for a week or more now that one of those positives is a Pennsylvania resident. So it's not a Chautauqua County resident, so it's got to get out of the state's database and into Pennsylvania where it properly belongs.
And that person, do they live in Pennsylvania?
Yes. It's everything like this is done on your county of residence. When you have a positive test result, it doesn't matter what the communicable disease is, any of those reportable diseases, is based on your county of residence. Doesn't matter if you were tested in Erie County, New York, or Erie County, PA. The Chautauqua County, New York, will get that result. Sometimes it takes a little longer, especially if it's another state, but we will eventually, be notified of all positive reportable communicable diseases.
So the people who maybe are showing up twice, so to speak, if they live in Warren and then they come to Jamestown for a doctor, it's because they came here to get tested?
Well, they wouldn't be showing up twice, but they could have come into Chautauqua County and gotten tested, and their test result we get that, and Pennsylvania should be getting it as well. We at the local level comb through all of those, and we know what's really ours and what's not, and we make sure it's sent back. The state health department, and I think Johns Hopkins, gets this data dump. They don't know who anybody is, and they're not taking the time to go through a case by case at this point like we are at the local level. So it makes a difference in what you really, how you really are managing your cases and doing your work. And that goes against us in the other way, not against us, but if you think of, there could be times right now where we've got people who are temporarily living in another area of the state, and they may go in New York City and be sick and have a test done there, but they are officially a county resident, so that's going to count as a positive for Chautauqua County, even though they may be working in New York City for 3 months. Then it will be a Chautauqua County positive case because their residence is here.
So the best way for people to get that up-to-date data is by going to the county's actual website if they're looking at it.
Yes, I mean, we're really kind of fortunate in New York State. I know compared to our neighbors in Pennsylvania, there isn't a county health department in each and every county that really is doing the boots on the ground work that we do. And sometimes we complain about all the regulations and rules that come out of New York State. But in a time like this, the state health department having a close track and really monitoring what everybody's doing is a good thing.
I do have one more now that I'm just thinking about it. The flattening of the curve idea, in regards to cases, I know we've had a fairly good stretch, and now we're seeing a few more cases reported each day. For a while, were you under that assumption that maybe we were there, or was that just a pause? Where do we stand?
Well, we never really had, we've never really seen an actual big spike or even enough that I would even call it a bell. So I think we were all waiting as this has gone on to say, okay, are we going to go up higher and higher and higher and higher so we can say we're on the downhill side? But we've pretty much stayed, pretty level here, We went, I think, 5 days, 6 days, even without a positive case. And now we've had, one here and there. But really not enough to even consider it a spike of any kind. So I think we're just going to ride this out and keep doing the things that we're doing and monitoring things as closely as we can as things start to loosen up, because they're going to have to, and go from there.
So compared to, like, say, Erie County, for example, who you can clearly see it. I mean, even downstate, you can clearly see it. Here in Chautauqua County, we didn't necessarily have that much of and I don't want to use the word impact, but we didn't have that many cases. Still something very serious to keep an eye on, but do you think it's because we're more rural?
So I think if you look nationwide, you can see where a lot of the main spikes and where you had a lot of illness and even a lot of death from this have been in your more metro areas. And those in the outlying areas haven't seen it that much. There was one state, and I apologize because I don't remember where it was, where there's a meat packing place that was out pretty much in the middle of nowhere, but that tells you when you've got people that are close on top of each other, and I don't believe that state had even locked down at all on any of the social distancing or anything that we've done here, and there is a tremendous percentage of that population in that plant that was positive and very sick.
Anything else? Seeing none, we'd just like to remind everybody, stay home, stay healthy, stay safe, and we will continue to be CHQ strong. Thank you.